there are some groups that are marginalized, either because they are migrants, either because they live with disabilities, either because they are refugees or people that live with AIDS or all such. These people, when they come forward to seek services, they are right off, they are abused, they are lashed out at, they are discriminated against. These are some of the places that technology has come in to create to give a kind of level playing ground for everybody. And interestingly, it has also come at a cheaper cost. Mostly, you find out that by just having data, people have been able to log on to the web, access information, and solve their problems. Recently, there is a noble concept of self-care. I think in 29, WHO developed the protocol, and Nigeria has its own guidelines put out there. So self-care is looking at, as a young lady, how can you test yourself that you're pregnant? How can you test yourself that you have STI? How can you test yourself for HIV? Just like COVID, if you self-test, then how do you go about accessing that linkage or referral to an health facility? This is also an area that technology has come in. So yes, and emphatically, technology has been of help in bridging some of this gap.
All right, thank you very much, sir. So to the next question, it says, how can we leverage on e-health tech to improve access to sexual and reproductive health services among women and girls in the hard-to-reach communities?
Yes, so this is a tough question. This is a tough one because what you define as hard-to-reach community has a lot of infrastructural issues. For instance, there are some hard-to-reach communities where the majority of the people, the socioeconomic status is a bit low. That's number one. Secondly, is the literacy level. The third is the infrastructure for e-technology. The infrastructure, maybe internet, maybe an Android. Sometimes there are some hard-to-reach places where there are no network. I don't know if you know about this, but I've worked in some of these areas. So these are some of the challenges. But that said, there are several models that have been developed in different places in Africa, in Kenya, in Malawi and Uganda, where young girls have been able to access a preset electronic device. Information has been put into them, and people are trained on how to access this device. And from time to time, they're able to get that information, even if they don't have some of these facilities or infrastructures that I mentioned. In the context that I work, what we have done at the time is that we go to the media, that's the conventional media now, the radios and the TVs, to give education, comprehensive education on health services, sexual and reproductive health services, like antenatal care, like family planning. And when we give this education, we have a question and answer section where people bring out all of their concerns and they are addressed. But that's not the myth. That's not the key information. The key information is that these sessions are recorded. And when they are recorded, we now put them on MP3. This MP3, now you have information on them in series, are now taken to hard-to-reach areas, and they are given to people. And people play them under the trees, people play them in their homes, people play them in several places. Of course, just like I've said earlier, because the radio transistor is so cheap, is affordable, and is available to almost every household, we have also been able to reach people through the radio transmission. These are some of the ways I think we can leverage technology to reach people. I have mentioned other model where tablets or phones have been pre-stored with information that are handed over to women and girls, and they access them. It helps them to track their menstrual challenges. Helps them to track information about themselves, about their sexual organs, about self-breast examination, and many other things, many other relevant areas of sexual and reproductive health services. Thank you, and over to you.
All right, thank you very much. Really, really appreciate your responses so far. Thank you very much. So the last but not the least question. So we would like to know that what are the effects of technology on women's sexual and reproductive health? What are the effects that, when we are talking about the sexual and reproductive health, what are the effects it has on women's health?
Well, most likely, if you wait, the effects are enormous and they are more in the positive than the negative. And I think the starting point will be to say that it has improved access to sexual and reproductive health services. I give you something. I've given you around menstrual cycle. There are also issues of maybe a woman finding out unusual things about her body, a woman getting pregnant for the first time. And because they cannot talk to anybody, they rely on technology. And you see people Google things like blood is coming out from my body or from my private parts. They cannot even say from their vagina. So through this, they're able to get relevant information. And the next level is through technology. Women and youngest have been able to also have linkages and referral to health facilities. So for instance, when you figure out that you have something that requires you to see a doctor, there are those forum or templates that allows you to have a confidential chat either with a health practitioner or with somebody who will link you up with the health practitioner. This has no doubt also increases the choices of women. For instance, maybe there's a maternity or health facility in their locality where if they had gone to, the staff there would have been hostile. So this has given them opportunity to access a more friendly environment, a more adolescent or youth-friendly facility. That is on that. That's on the SRE services. There's also the issue of information, which is also very huge. A lot of information is right there through technology that has been made available to people, women, girls, and even all categories of people. I think these are very positive effects that it has had. You know, there is a different types of restriction that we face. There's legal restriction. Sometimes there are political, there are cultural. In countries where, for instance, abortion care is restrictive, women has deployed the use of technology to be able to access harm reduction opportunities, harm reduction services. That is that. Also on the effect of technology, you will recall that recently, the world was brought on a news by COVID-19 pandemic. And I mean, it practically shut down our economy, our health facilities, and all of that. I think technology came to play at that point. Unlike before, when I would have needed to travel to your location to have this meeting. I don't even know your location. Now, virtual meeting became the order of the day. Likewise, in terms of technology for SRE services, it became a lot more popular. And I think the world is better positioned and ready to provide quality SRE services For women and young girls, in the case of another pandemic that forces our system, our health centers or facilities to shut down. Not only that, there's also the aspect of self-care. So a lot of private organizations or development partners are putting self-care tips. They are putting them on the through technology, and they are reaching out to people. There's also the aspect of the reduction in stigma that comes with the use of technology. Of course, there's increased confidentiality, it costs, and so on and so forth. However, it has a tendency to result in exclusion. And what that means is, as good as it sounds, there may be some category of people who, for different reasons, are not able to use them, either due to literacy, either due to infrastructure, like I mentioned. So we have to look out so that we don't continually leave those ones excluded. Additionally, there's also the aspect of uncertainties. Sometimes you get so many information that could make you even confused rather than clarified if it is not managed. These are some of the effects of technology on sexual and reproductive health. Thank you.
All right, thank you so much. So we have another question from our people that joined online on Facebook. It says, what are the impacts technology has on women's sexual and reproductive health?
Okay, so the difference between, I think there is a strong overlap between effect and impact. My thinking is that effect to a larger extent will be the change as a result of the technology. But for the impact, I think, for instance, if you look at the ability to analyze data and to use data for accountability and to take data-driven decision, I think technology has been quite impactful. If, for instance, 150 women and girls have accessed a certain facility or a certain service, by the time you need to review this data, it may be anonymous in not bringing out the name, it may not. But what is quite clear is that you are going to get what is there, is the symbolic beavers, So it has improved, it has helped with analysis and the ability to have good data, and which you can use to take several decisions. In terms of accountability, I think it has been impactful, with precision in terms of data. It helps with accountability process. It also helps with resource management. If you know that 70 people have accessed a service, then you can be able to, based on your budgeting, provide or give account of how you have spent your resources, and it has helped in planning, and of course, like I said, in decision making. I also think that it has been huge in being a template for comprehensive sexual education. And I think comprehensive sexual education is also a right to everybody. I think it has helped. It has helped bring to the hands of people what otherwise are in the hands of the older grandwomen who tell us myths, who tell us things that are not necessarily correct. What other? I think the privacy of end users has been key in this. Unlike the visibility that comes with going to access care in person at the health facility, of course, your privacy is protected 100% through technology. These are some of the impacts that I would say technology has had on women's sexual and reproductive health. Thank you.
Okay, thank you very much, sir.
All right. Thank you very much, sir. You've made quite a huge input and on this topic. And we know our women out there are hearing us and they're learning a lot from you. I want to use this opportunity to welcome another speaker in the house, Mr. Nathaniel, or rather Dr. Nathaniel. I hope he's here. Hello, sir. Are you there? Hello, sir. Can you hear us?
If that is me, I can hear you clearly.
Sorry, sir. We also have another person that joined. I don't know if he can hear us. We can still see his hand up, but I doubt if he can hear us. Hello. Hello. Can you hear us? Are you there, sir? Mr. Nathaniel. Okay, I guess we lost him again. So we just call it up. I don't know if anyone else has a question to ask before we call it up here. Hello, everyone. Victoria, Destiny, Esther. Do we have questions for our speaker? Okay, in the absence of questions, we want to say thank you very much to our speaker, Dr. Olufemi Akin-Ola. We appreciate it. Thank you so much for honoring our invitation today. And we've learned a lot, and we know our women have the embracing equity is very important. From what we've learned from you, said we are in a digitalized world where every woman should be given opportunity to explode and have all that it takes. So we want to say thank you once again. And for our women, are you a woman with unmet sexual and reproductive health needs? Speak with our sexual and reproductive health experts today. Through our numbers on the screen: 070 480 65486 or 080 480 65450. You can also visit some of the healthcare facilities that we're working with, or WhatsApp us here also. And just on the screen there, you can see the local government. Are you in Cross River State? You can always reach out to those health facilities in Cross River. And Iboki, Calabar Municipal, Ikom, Obudu, Ibiase, Bakassi, and the rest of them. So I want to say thank you everyone once again for joining. We really appreciate you, and we know we've all learned a lot. And after this, we can boldly say we are embracing equity, and then we can always stand out and have a voice to our body rights. We can always exercise our bodily autonomy as women. So thank you once again, Ms. Dr. Olufemi Akinola. Thank you once again. So we hope to have you in the next section also. All right. Bye, everyone.